All right. Hello, Dr. Nazir. It's Abdullah here, and I'm going to be your examiner today. So you have a 45-year-old male patient presenting to you by Jaundice. Please take history from the patient.
Hello, I'm Dr. Nazir. I'm one of the surgical doctors for today. Confirm your name and age, please.
Hi, my name is Abdullah. I'm 45 years old.
Nice to meet you, Abdullah. Today I've been assigned to ask you a few questions regarding your conditions. Is it that would be okay with you?
Yeah, of course.
Okay. So while taking history, I might write down some important points. Is that okay?
Yeah, of course.
Okay. Well, what is your main concern from today's consultation?
Well, a few weeks ago, my wife told me that I'm turning into a little bit yellowish in color, and my face and my eyes as well was getting a little bit yellow. And now, as you can see, I'm completely turned into yellow.
I'm really sorry to hear that. Must be stressful for you. Could you tell me more about your condition? When did this started? Is this gradually or suddenly?
Yeah, I think a few weeks ago, and it went in gradually and kept building up until now. I think it's quite severe, and everybody's noticing it, and it's causing me a lot of troubles.
Yeah, I'm sorry to hear that. Do you mean that this condition is increasing?
I think, yeah, it's significantly increasing. I barely noticed it in the first few days, but my wife kept telling me that. And yeah, and suddenly it kept getting worse and worse.
Let me ask you another question. Does anything make it worse?
I haven't noticed anything really.
Okay, does anything make it better?
Well, I'm not sure. It's not getting better, just getting worse and worse.
Okay, I would like to ask you a few more questions. If there's any yellowish discoloration in the skin?
Yeah, yeah, I think I said that my skin is yellow as well. My skin and face and eyes.
Have you noticed any change in the color of the urine or the stool?
Oh, yeah, that's correct. I think it's getting a little bit darker in color. I think so.
Yeah, okay. Do you have any epigastric pain or vomiting?
I'm sorry, doctor, what is epigastric pain?
Sorry, I'm sorry. Do you have any pain at your tummy?
Oh, no, not at all. No pain at all.
And does this no at all, and there is no any pain that relieved by laying forwards or something like that?
No, no, nothing at all. Nothing at all.
Oh, do you have any intentional loss of weight?
Well, to be honest, I've been trying to lose weight for ages now, but
And there,
I thought recently after I changed my diet, I thought that my body weight is getting better and better. But I have tried for years and years to lose weight, and suddenly for the last like maybe 4 months, I lost maybe 4 stones or 3 stones.
okay, and there is no loss of weight. There's no loss of appetite or something like this.
Well, I'm not eating as I used to, but I wouldn't say it's completely lost, but I'm not eating as I used to.
Okay, so that's fine. And I want to ask you about if you rate. I'm sorry. Do you have any other medical problems?
Um, no, I'm not. I'm a healthy man, 47. Don't complain of anything really.
Yeah, that's great, fantastic. Do you had any previous operations?
But I had my appendix taken out when I was 20, but since then nothing happened.
Okay, do you take any medications?
Uh, no, no medication, just paracetamol if I get any pain or headache or something, but nothing else.
Okay, also do you don't have any drug allergies?
Not what I'm aware of, no.
Okay, do you have any family history of a similar condition?
No, I don't think that was a similar condition, but I remember my father died of colon cancer. It was quite terminal.
Okay, I'm really sorry to hear that,
No
and
worries.
I'm sorry for your loss. Do you mind if I ask you some personal questions?
Um, yeah, of course you can.
What do you do for a living?
Well, I currently work as an engineer.
Okay, and who do you live with at home?
Yeah, my wife lives with me, and I have two kids, but they are not with us. They live away from us.
Okay, that's great. Do you have any difficulties with the stairs?
No, I'm quite around all the time and moving. I'm quite a healthy man, I would say.
Okay, so do you smoke?
No, I've never smoked.
Do you drink alcohol?
Yeah, occasionally.
Okay, so how many units per week do you drink?
Well, I'm not sure about the units, but maybe, glass of wine every week or something.
Okay, so what is the cause of the problem, do you think?
I'm sorry, Nazir, time's up. So that is 6 minutes of history. I'm going to ask you a few questions as an examiner. Would you like to present your case?
Uh,
So what do you
okay.
think is going on? What's your differential diagnosis for this patient?
I think the bench diagnosis first case maybe يكون acute pancreatitis, biliary colic, inflammatory bowel disease, or cancer colon.
Okay. Anything else?
As in that case, the only thing that clues is he has a jaundice in the case scenario. So
Yeah.
I don't know that maybe more than this differential.
Okay, that's fine. No worries at all. Also, what would you like to do next for this patient in terms of investigations?
I would like to do some bloods. I will try bloods like the serum amylase and the lipase. I would like also to do laboratory and radiological. So laboratory, I will do laboratory as amylase and serum lipase and full blood counts and LFTs and urea electrolytes. Also, I will go for an abdominal ultrasound and maybe I go for an ERCP.
Okay. All right. Okay, what do you think it would be the management for this patient if you've done a CT scan and found out that the patient has a mass in the pancreas and the amylase is a little bit high and otherwise the bloods are unremarkable? What do you think would be the management for this patient? The
The
initial
man
management, definitive management.
I think the patient will need to go to the ITU, the intensive therapy unit.
Mhm.
Uh, I'm sorry, actually, I'm not remembering now.
It's all right. No worries at all. I think I'm asking other questions. It doesn't have to be in your notes, but these are, I think, I'm going to give you feedback. So Nazir,
Yeah.
I think I would start by just asking you, what do you think? What do you think of your performance?
No, it's not good.
Okay. To be honest, I wouldn't say it's not good. It's all right. You've gathered good data. You've gathered enough data, I would say, and yeah, I mean, you asked the presenting complaint quite well in terms of, I mean, I'm sorry, I can't share the screen. But anyways, yeah, you asked about the presenting complaint quite well in terms of the jaundice. You've done good assessment for the jaundice. You've asked about abdominal pain, and you've asked about other associated symptoms, including the weight loss and the loss of appetite and so on, which is quite good. So I think my way of doing the history, you always ask about the presenting complaint, including the jaundice, and in jaundice you will need to ask about the onset, the course, the duration, and the factors increasing the jaundice, and also the factors decreasing it, which you've done: urine color, stool color, and maybe etching as well. Abdominal pain is significantly important to ask about, and this is you're thinking of one of two things. All right. So if there is abdominal pain, we're thinking of biliary, such as choledocholitis or gallstones, but mostly choledocholitis or common bile duct stone. Okay, and if the patient doesn't have pain The main thing that you need to think about is this is a painless jaundice. That means it could be a pancreatic cancer, and the pancreatic cancer should be the top of your list. All right. The other thing is still common bile duct stone is one of the important differentials. One thing that we need to rule out is ascending cholangitis. All right. So we need to ask about if the patient had any fever and any night sweats or any night fever as well. All right. So if they have any fever, we need to assess the onset, the course, the duration, factors increasing, factors relieving, and the time of the day they get this fever. Okay. You've asked all the associated symptoms, but I will include as well the vomiting, the nausea, the diarrhea, and the constipation, because they are relevant to any mass that is present in the epigastric region. Okay, nausea, vomiting, diarrhea, and constipation. And then you can also include some systemic symptoms, which you mentioned, like the weight loss. You can also ask about the anemia and lethargy, feeling weak all the time, and night sweats and
but
night
the
fever.
time was ended, so I didn't have time to ask about the
Yeah,
other
of course.
systems. Yeah.
Of course, but I think practicing will make this happen very quickly when you practice a little bit more. So you just need to ask question after question very quickly. Okay.
I need to ask you a question because the only I heard about the stem that's only jaundice, so that's why there's no pain. So I didn't ask about the Socrates. So
Yeah.
I just asked about the associated features, which is related mainly to the jaundice. So I think about acute pancreatitis and cancer. There's
Yeah.
only two differential sent me.
Yeah, I think pancreatic cancer would be the top of your list in terms of differential diagnosis. So after doing your presenting complaint, consider some differentials. Like I said, the trauma, being alcoholic, having gallstones, and also if they had any sort of weight loss and so on, thinking about cancer. You've asked the past medical history, the drug history, and also the occupational history very well. The only thing I would say is when you take in past medical history, try to ask specific questions in addition to an open question. So just give me an open question. Do you have any past condition or any medical condition? If I said no, well, you've never had any gallstones or any recent history of cancer, personal or family history, things like that. All right. So just to make sure you're telling your examiner, well, I'm concerned about cancer or I'm concerned about pancreatitis. Okay.
Can I ask the patient, do you have any family history of, let's say, cancer? And I didn't reach a full diagnosis that he's a cancer, or I'm just looking for a
Well,
provisional diagnosis.
of course you can, and you can show your concern that it might be cancer, but you will always need to signpost your patient. So, for example, the way I would ask it, if I want to ask the patient about cancer, well, I will start it like that. It's just a routine question. Don't get worried by my question, but I just want to ask, have you ever had any history, any personal history or family history of cancer? Okay. It's an okay question. You can ask it, just signpost your patient and reassure them before asking the question. Don't get me wrong. I'm not. It's just one of the important things we need to rule out. Have you ever had any history of cancer or family history of cancers? All right. The other thing is ice is a very important thing to ask about, and it doesn't have to be sort of robotic. You don't need to leave the ice till the end of the scenario. So you can ask for ideas even when you're starting. Okay, you can ask about concerns even before taking any history. Okay, so you can even start. Well, I understand that you coming with jaundice. So what's your main concerns about this issue? Okay, and the other thing, when I show a concern, try to address this concern. So I said at the beginning when you asked me, I said, well, it's causing me so much troubles. So you need to ask about this. What kind of troubles is it causing you? Is it affecting your work? Is it affecting your daily activities? And then you can elaborate more about these concerns. Okay. And then maybe at some point, and it doesn't have to go in the same order. It doesn't have to go ideas, concerns, expectation. You can ask from the start. So what's your expectation about your today's visit? From the start, about what's your expectation about today's visit? Well, I would say I would like to be seen or have some investigations or whatever. All right. So you can ask it, just always include it in your history taken, and it doesn't have to be, robotic or mechanical to leave it to the end. Okay. So I think you did not ask for ice, but like I said, always include it in your history and so on. Investigations. I think I'm pretty sure that you're watching the videos. So always get your investigation, bedside investigation, and bloods and imaging and invasive. All right, that will will really organize your thoughts. So for bedside investigations, if the patient is coming with pain, this patient obviously is not coming with any pain. You can get, ECG, urine dip stick, and urine dip and pregnancy test and so on. But if the patient, in this patient, our bedside investigation could be doing a baseline ECG. Okay, that would be only it, to be honest. Baseline ECG. All right. And also in terms of bloods, you need to get an FBC and always mention why. So I'd like to get a full blood count for this patient to look for the sign of anemia because the patient had lethargy or weakness, and also look for, the basically hemolytic anemia as a cause of jaundice. Two, I would like to get UNE for look on dehydration or any electrolyte imbalance. Liver function test to get the differentials between AST and ALT to diagnose the type of jaundice. CRP for inflammatory markers. Amylase for acute pancreatitis. And bone profile looking for the calcium level. I would like also to get group and screen and the coagulation profile and cross-matching in case the patient might need to go to surgery. I would also like to get acute liver screen, and the acute liver screen can include all the virology, hepatitis A, B, and C, even HIV. You can do that as well. And for autoimmune hepatitis, you can get, IgM and IgG. That's the acute liver screen. You can also get iron profile and also ceruloplasmin for Wilson's disease and hemochromatosis. Okay, so now we covered all the differentials of jaundice, which is pre-hepatic, hepatic, and post-hepatic. In terms of imaging, we can get a CT abdomen and pelvis with contrast, and always make your answer very specific. Don't just say, I would like to get a CT abdomen. No, CT abdomen and pelvis with contrast to rule out any liver mass or pancreatic mass. Okay, and then invasive investigation. We don't really need invasive at this stage, but you can see, I would say it this way, we don't really need invasive at this stage, but I might need to do an ERCP at some point, whether a diagnostic or therapeutic. Okay, just as simple as that. After mentioning all the investigation to your examiner, you can move into, I asked you a question about your differential diagnosis. When you're answering the differential question, you also need to mention the rationale. And the rationale here, you say, so I have a 45-year-old patient coming with painless jaundice. My top differential will be a pancreatic cancer because this is the commonest cause for painless jaundice. However, I would like to exclude any gallstone or common bile duct stone or ascending cholangitis or acute hepatitis. That will be your differential diagnosis. Okay, so always you mention the rationale, and the rationale here is most likely to be a pancreatic cancer. Well, when I asked you to present, it's all right that you forgot, but make sure in an exam you will be able to collect all the data and write it and try to memorize it. But when you are presenting a case, try to mention a single line at the beginning that summarizes your finding. So the way I would present in here, I have a 45-year-old male patient presented with painless jaundice that started 2 weeks ago and has been increasing, or maybe a few weeks ago, has been increasing and well noticed on the skin, the sclera, and the face. The patient has lost weight, lost appetite, okay, and lost around 4 stone and lost appetite. And let's say there is no night sweats or night fever. I am concerned about cancer. And also, when you're presenting, you need to suggest some investigation and suggest some further management. I will be concerned about pancreatic cancer. I would like to do some investigations, including bloods and bedside and imaging to rule out cancer or gallstones. So that's your presentation. 2 lines, very summarized, very short, because you don't have so much time in the exam. Correct?
And I would
Does it make
start with the
sense?
positive findings and then the negative findings.
Well, to be honest, the way I'd like to present it, I always mention the main positives first in the first line, all right? And the examiner can stop you, all right? So if you notice from my presentation, I only mentioned the main positives. For the negatives, they can stop you, and if they didn't, you can continue by saying, well, chronologically, I asked him for this, and it was negative, for this, and it was negative, and so on and so forth. But mainly, because you don't have so much time, right? So I summarize the positives, and then otherwise it was unremarkable. There is no other history, just a single sentence. Okay. And also, Nazir, it's quite important. I think this is particularly for you from your presentation today. try not to use any fillers in your speaking. So, for example, don't say I've asked him this and he answered this. You're wasting too much time and too many words. So I think maybe use directly. So 45 male patient presented with this and this and this, and he had this and that and that and that. Just the direct answer without saying I asked him this. The examiner was listening to you, and he know very well what you've asked the patient and how did he answer.
So I start now.
Yes, please.
Yeah. So, hello, I'm Dr. Nazir, one of the surgical doctors. I was told to speak with you about your child conditions. Can you tell me first what do you know so far about your child?
Doctor, I don't know anything. I just know that he's going to surgery. Can you please reassure me and tell me what's happening now?
Yeah, I need you to be reassured. First, you don't have to feel guilty because this could happen anyway. Your daughter was brought to the A&E with complaining of a tummy pain, and our investigations revealed that she has the suspicion of acute appendicitis. And she was managed by our registrar, and she received IV fluids and antibiotics. And now we are waiting for the consultants that he will operate on her.
Oh my God, that's really difficult. So you're saying to me that she's going to surgery now?
Yes, yeah, as I told you, that we are suspecting that your daughter she may have acute appendicitis, and it's a common condition at that age, and all her signs and symptoms denote this. So we are not sure 100%, but we
Oh,
will
doctor,
go for
I
surgery.
feel so guilty. I left her today and I went to work and I left her with my neighbors. I feel so guilty for that. Is it serious? Is it a serious condition?
Yeah, actually, it's serious because in your child case, if we left her, so we might have a perforation, and perforation it's dangerous because it may go to the ITU or something else, and may leads to other complications in the future. So we have to operate it now.
Oh, not again. You just said perforation. This happened to my husband 3 months ago, and
And I'm
he
really sorry
died.
for your husband.
And he died. Can you
I'm
please
really
tell me
sorry for the loss.
yeah, who's the operating consultant?
The operating consultant is Mr. Abdullah. He will do the operation, and I want to be reassured because your daughter now in a well and experienced surgeon, so he will do his best to manage your daughter's
No,
case.
no, doctor,
Hold
you
on.
don't understand. This consultant, like, well, that's very bad. But I think my husband died under the care of this consultant 3 months ago, and I think it was the main reason. There a possibility that we can change this consultant by any chance?
I'm really sorry for your husband loss, but I think that this is maybe some complications happened. It's quite common, maybe happen in the theater, but he's a good consultant and he will do his best to save your daughters. And I
No,
think that
no,
if
doctor,
it's
I don't think that you understand the situation. I think it was the main reason that my husband died.
No, no, I don't think so. But now the case it's an emergency, and we cannot now call for another consultant. It will be a time consuming, and he will start to read your case note and from the start. So I don't think so. That it will be a good idea that we change the consultant now. Is that okay?
Can I speak to the consultant, please?
I don't think so. I can call him now because he's in emergency theater, so he might not be able to pick up my call.
Are you sure, doctor, it's appendicitis?
Yes, I'm not sure 100% because no one can diagnose appendicitis 100%. That's why we do an open surgery and laparotomy, and at that time we can open and see if it's 100% appendicitis or not. But all the symptoms and signs of your daughters tell us about that it may be an appendicitis.
Have you seen her, doctor?
Yeah. I'm see here in the E&D, and because your child's condition it was an emergency, so we taken here and we did all the labs investigations and the radiological imaging, and we took her to the theater immediately.
All right, so you're telling me you're not sure that she has appendicitis or not, and you're gonna take her to theater anyway, and it's with a consultant that I don't agree with, and I can't speak with the consultant. So what do I have to say in this? Is just so depressing.
I'm really sorry for that, and I can appreciate your feelings. I know how you are frustrated and worried about your children, but I need you to know that we are doing everything for your daughters to save her condition, save her life, and the best interest for her. And she's in emergency condition, so she was taken to the theater immediately. And as I told you before, we have been through that appendicitis. It's a more common clinical diagnosis, but we cannot be sure 100% it's a appendicitis until we go and operate her, and then after that we will see is it appendicitis or not. And this is all in the literature have been written that it is diagnosis by operation and laparotomy. So is that okay with you?
Yeah, yeah. Can I just ask? I know that appendicitis does affect the ability to get pregnant later on. Will she be able to get pregnant?
Yes, that's a good question. But if we left appendicitis and there's a severe infection, so that it may be block the tubes, the reproductive tubes in the especially young girls. So may in the future subfertility might happen. So that's why that we taken her to the theater, and it's an emergency operation.
Mhm. Okay.
So do you have any other questions?
No, I think that's it.
Okay, thank you, and we'll see you after that your child gets well soon. Thank you so much.
Thank you. Okay. Again, Nazir, what do you think of my
Uh,
performance?
this is my first phone call. I don't know. You gave me the feedback, but I think that the scenario from the notes I'm studying in
It's a
is
little bit different, isn't it?
yeah. So I
Yeah, man.
couldn't pick up most of the
I mean,
questions.
I know. Like I said to you before, I do collect the notes from different sources.
Yeah,
And there are questions from here and there, but you don't really need to rely on that because the patient can change their tone, they can change the way they ask questions. So you just need to get good communication skills no matter what. All right.
yeah.
Um, good. So I think going back, so your introduction, try to make it sharp in terms of present yourself very confidently and confirm who you are talking with. That's number one thing to do. um, I might be a daughter of the mother of another daughter, right? So always
Yeah.
confirm the who the patient or who is with you, who you are speaking with, and if you're speaking with a relative, always ask them what's your relationship to this patient or the patient name. All right. um, and then start by always saying, I understand you do have some concerns about your child, and I'm here to help you answer these questions. And can you please confirm what have you been told so far? Which I think you asked me this, but always start by just some sort of signposting and reassurance that you're here to answer their question, and the smiling and nice and so on. All right. And then there is one important thing, very important, that I mentioned at the beginning, that I was feeling very guilty. And I said to you, oh my God, I left her and I feel so guilty for this. Okay. There are two issues in here. Issue number one, you need to reassure me that I don't have to feel guilty, or I do have to feel guilty, whatever you would like to do. So say, I appreciate your word about your daughter, and we're here to help you, and hopefully we'll be able to manage the situation very well. You do not have to feel guilty, as usually acute appendicitis doesn't have a particular reason behind it. Okay. And as soon as your child is better, you will be able to talk to her in more detail. So your child, and then go on to the patient presentation. So your child came in with tummy pain, and our initial investigation showed something called appendicitis. And always elaborate. If you want to use medical jargon, it's okay, but you have to elaborate. Okay, so which showed appendicitis, which means an inflammation of one of the extra organs in our bowel, which is called the appendix. Okay, and then also check the patient understanding. By any chance, have you came this term before? So if you understand, the patient might know what is appendicitis. And then when I asked you, is it definitely appendicitis? You said, yes, could be appendicitis, but we need to do this. Well, that's a good answer, but try to not be so certain about your diagnosis because you personally have not seen this patient. Okay. And I know your scenario, you said the scenario is a little bit different, and that's why I asked you specifically, have you seen this patient? And you said yes. The scenario doesn't say so, so don't make up an answer. So the scenario says, like I showed you the box early, a 10-year-old girl came or admitted with emergency peritonitis, been unwell for 2 days, and it doesn't even say that you've seen the patient. She's been resuscitated by your registrar and has been taken to operating theater. Don't assume that you were there. You haven't seen the patient. You can always answer, well, I'm unsure. I have not seen this patient yet, but I can reassure you after our consultation, I will go and speak with the patient, or I will go and find out. It's absolutely fine to say that, but do not try to make up an answer. Okay. And then when I asked, is it definitely appendicitis? I think you sort of said it's not, but you said it's very high chance it's appendicitis. Again, just take it down. Say I wouldn't say it's definitely appendicitis, but likely to be appendicitis for some reason. It's common in this age, and the presentation is quite typical. However, we will never be sure until we do a surgery, which is a keyhole surgery for diagnostic purposes, and removal of the appendix if it turns out to be appendicitis on our assessment. Okay, so don't try to be very certain about your answer. I also asked you about will she get pregnant? So that question you've answered it very well at the beginning. You said that's a good question. Yes, reassurance is very important. Just try to reassure your patient at the beginning, and then yes, it's a good question. And thank you for bringing it up. Infection might spread to the tube and lead to obstruction, and it can lead to subfertility. However, for the risk benefits, we think that the patient needed the surgery. Otherwise, it can lead to serious things such as sepsis. Okay, so that's the answer to that question. I know that this is not about Mr. Man or the surgeon name. Again, you had the surgeon name and the stem, which was Mr. Man. I'm not sure if I mentioned it to you, but it's fine. Just try to know the name of your consultant when you're going in. And also, when I told you that, well, my husband died because under the care of this consultant, don't try to defend. You were not there, so do not defend your consultant.
So
Okay.
what should I say in this situation if she
Yeah,
was
and also
attacking the consultant?
do not try to throw them as well. So say, I'm really sorry, I'm unable to comment on this. I have not been there in that instant or that scenario. However, if you're concerned about anything, I can arrange a meeting with you and Mr. Man if you're still concerned, but that will be after the surgery. Okay. And also when I said, okay, I want to meet Mr. Man, you said no, you can't. I mean, Nazir, it's the right answer, but the communication here should not be in this way. So you would say it's a very valid concern, and I appreciate you want to meet him. However, he's currently looking after your daughter in theater, and what we can do for you is we can arrange a meeting after the operation, and I will definitely speak with him. Things like that. So it's like you're when the patient asks a question that can lead to a problem, which is there is a problem. She want to meet the consultant right now. Well, you can just take the problem and reassure that we're doing something else, in return, which is looking after your daughter. And after that, we can come and speak with you in more detail. All right. And at the end, if you do have time, you can summarize the data. However, in a very, patient is unwell and so on, and it might be bad news for the patient. So try to be very mindful when you're summarizing the data. So you can say just to summarize at the end, just to summarize and to make sure I haven't missed anything. So we talked today about your daughter. She's currently being taken to theater for removal of an appendix, and I'm going to arrange a meeting with you and the consultant after the surgery, and you will be able to see her after, and so on and so forth. Just summarize the main points in less than 30 seconds, literally. All right. After you've done this, is there anything else you want to tell me? Is there anything else I can help you with? And then close your scenario by thanking your patient. Okay. That's the way I would say as a feedback for you. So, I mean, the main points of the feedback for you is your start need to be a little bit more sharp. 2 is reassure your patient, always reassure and listen to your patient. And also, if they're feeling guilty or feeling bad, try to elaborate more and ask more questions about this, and also reassure them in that sense. And do not give a very direct answer like a yes or no. It doesn't go this way. You need like sort of to balance it between the yes and the no, and make it something in between that seems a little bit nicer, but it's still not wrong. So it's not like you're being asked, is it appendicitis? You will say, well, it could be and it couldn't be. No, it wouldn't be this way. You will just say, well, from the evidence that we have, it's likely to be appendicitis, but we can never be sure until we do the laparoscopy and find out. All right. Does it make sense?